Today, we're diving into the incredibly complex world of healthcare. Think of this as your personal travel guide, a map to help you understand all the different doctors and specialists out there. So let's get started.
You've probably heard these terms thrown around before: primary, secondary, tertiary care. But what do they actually mean? Well, understanding them is the key to really navigating the system and making sure you get the best care possible. So let's break it down.
Here's our plan for today. First, we'll lay out the basic map of healthcare. Then, we'll meet the huge variety of specialists. After that, we'll take a look at how doctors even pick their specialty in the first place. And finally, we'll peek into what's coming next in the world of medicine.
All right, first up, the big picture. You gotta know the layout of the land before you can explore it, right? Getting this down is the first step to being a smarter patient.
So, to make this all feel a bit simpler, let's use a great analogy from our source at Yorktown Health. Just picture a pyramid. The bottom is wide, representing the care that most of us need most of the time. And as you go up, it gets narrower and much more specialized.
That wide base, the foundation of the whole thing, that's primary care. This is your family doctor, your pediatrician, your medical home base. They're the ones you see for your annual checkup, for the flu, or for managing ongoing things like diabetes. They really get to know you, and that long-term relationship is proven to lead to better health.
Okay, let's move one level up the pyramid to secondary care. This is where the specialists live. When you have an issue that needs a deeper dive, your primary care doc will refer you to someone with extra training, like a cardiologist if it's a heart issue, or an orthopedic surgeon for a bum knee.
And at the very, very top of the pyramid, you've got tertiary care. This is the most advanced, most complex medicine out there. We're talking about things like organ transplants, major open heart surgeries, or cutting-edge cancer treatments that you can only get at highly specialized hospitals.
So how does this actually play out? Let's follow a patient. We'll call her Sarah. She starts having chest pain, so her first call is to her primary care doctor. After some tests, that doctor says you need to see a specialist and sends her to a cardiologist. That's the jump to secondary care. The cardiologist then finds a serious blockage and refers her for bypass surgery. And that is the final step up to tertiary care. See how it all connects? Okay, so now that we have the map, let's meet some of the people who work there. We're moving from the big picture structure to the incredible variety of doctors who make it all work. Get this. According to Med School Insiders, there are more than 84 different medical specialties and subspecialties. That is just a staggering number. It really shows you how incredibly detailed and focused modern medicine has become. So, how does anyone make sense of that? Well, we can start by splitting that huge list in two. There's a fundamental fork in the road, and it comes down to one simple question. Is the treatment primarily medical, or is it surgical? That one question makes everything a whole lot easier to understand. So on one side, you have medical specialists. Think of neurologists or psychiatrists. They focus on diagnosing and managing conditions, usually with things like medication. Then you have surgical specialists, like neurosurgeons, who use tools and their hands to physically go in and fix the problem. It all comes down to the method of treatment. And the variety is just amazing. You've got cardiologists for the heart, dermatologists for the skin, neurologists for the brain. Then on the surgical side, you have orthopedic surgeons fixing bones, anesthesiologists who are basically your guardian angel in the operating room, and radiologists who use incredible machines to see right inside you. Each one is its own little universe. So with more than 84 different paths, how on earth does a doctor pick just one? This is where it gets really personal, and it's a mix of science, personality, and, just life.
Let's be real. The financial side of things is a factor. And as you can see from this data from Stanford, the differences in pay can be huge. A family doctor might make around $200,000 a year, while an orthopedic surgeon can make more than double that. It's not everything, but it's definitely part of the equation.
But of course, it's about so much more than a paycheck. Choosing a specialty is a massive commitment. It's your life's work. So the decision is driven by a whole lot of personal factors that have nothing to do with money.
One of the biggest questions a med student has to ask is, how much do I want to interact with patients? Do you want to build those decades-long relationships, like in family medicine, or do you thrive on quick, intense encounters, like an ER doc? Or maybe you'd rather have almost no patient contact at all, like a pathologist working in a lab.
And then there's the big one, work-life balance. Some fields, like dermatology, tend to have more predictable 9 to 5 hours. Others, especially surgery, are famous for grueling schedules and being on call all the time. It's a huge choice about the kind of life you want to have outside of the hospital. And this has real impacts on all of us, too, Because the tough lifestyle in fields like primary care can lead to shortages, making it harder for everyone to find that medical home base.
For our final stop, let's look ahead. Because medicine is never standing still, it's always evolving, and it's creating entirely new kinds of doctors to solve the problems of the future.
Have you ever heard of a nocturnist? As the AAMC describes it, this is a doctor who chooses to specialize in working the night shift. For a patient, that's huge. It means you have a doctor who is wide awake, dedicated, and focused on your care overnight, not someone just trying to survive a 24-hour shift.
Or how about the medical virtualist? This is a doctor who practices almost entirely online. Think about what that means for people in rural areas, or for anyone who has trouble getting to a clinic. You can get world-class specialty advice right from your living room. It's not just changing the doctor's office. In some cases, it's getting rid of it altogether.
And this one is so interesting. The lifestyle medicine physician. This is a doctor who focuses on getting to the root cause of chronic diseases. Instead of just writing a prescription for a pill, they work with you on things like diet, exercise, and stress. You might literally leave the office with a prescription for broccoli, which is pretty cool when you think about it. It puts so much more power back in your hands.
So, we've gone from the basic map of healthcare all the way to its most innovative new frontiers. And this quote from Yorktown Health really ties it all together. Just knowing the layout of the land is the single most important step you can take on your own health journey. And that leaves us with one final thought. We're seeing this explosion in medical knowledge and technology, which is incredible. But as the world of medicine gets more and more complex, what does that mean for us, the patients? How are we going to navigate this amazing but complicated future to get the best care for ourselves and our families?